Schizophrenia is a disease that affects the brain, which alters the brain chemistry and mainly affects cognition. This brain disorder is characterized by a breakdown of the thought process and by poor emotional responsiveness. This illness manifests through hallucinations, delusions, and disorganized speech and thinking. People with schizophrenia may experience anxiety disorders and a lifetime of substance abuse. According to Medical News Today, changes in key brain functions such as perception, emotion, and behavior have led experts to conclude that the brain is the biological site of schizophrenia. Genetics were thought to be the only cause, but other factors such as stress during early life, drug-induced psychosis, fetal malnutrition, environmental factors, and child abuse and trauma have also contributed to the causes. Paul Thompson, a professor of neurology at the UCLA School of Medicine, did studies on a group of teenagers by doing repeated MRI scans on them, and he detected gray matter loss of 10% of the first in the outer regions of the brain. The loss of the gray matter spread to engulf the whole brain in over 5 years. This is a brain of a schizophrenic. The red part is the gray matter that will eventually take over the whole brain, and this is a normal brain. The outer regions where the gray matter takes over controls the memory, hearing, motor functions, and attention of the brain. What this means is the brains of schizophrenic has to work harder during a reaction time test than a normal brain. There are two types of symptoms, positive and negative. The positive symptoms include delusions, disordered thoughts and speech, and hallucinations, and the negative symptoms are flat affect and emotion, poverty of speech. They also have the inability to experience pleasure, lack of desire to form relationships, and lack of motivation. There are 3 stages of schizophrenia. The first one is prodromal, which occurs the first year of the appearance of the disorder. The signs can be mistaken for other mental illnesses such as depression or bipolar. The signs include social isolation from family and friends, deteriorating schoolwork and performance. Usually they'll experience these signs or this stage in the late teens to early 20s. The second stage is the acute stage. Symptoms are very apparent and has positive and negative symptoms. Some of the symptoms can be so severe that they need to be hospitalized, and this occurs usually early to late 20s. The last stage is the residual stage. It's very similar to the prodromal stage. The symptoms have diminished, but behavior and thinking still may appear strange, and this occurs early 30s and on. Antipsychotics were introduced 50 years ago, and it was the first effective treatment for schizophrenics. The patients may need to try several or maybe a combination of the medications to find out which one works best for them. It takes up to 6 weeks to see if the medications are the appropriate ones needed. Side effects of the medications include sleepiness, dizziness, weight gain, increased chance of diabetes, jitters, slow movements, and tremors. About 25% of schizophrenics live with their family, 28% live independently, 20% live in group homes, 10% live in hospitals, 6% live in jails or in prisons, and another 6% are homeless or live in shelters. But schizophrenia only affects 1% of the American population.